Now we're talking to another rising star, Henry Knoop. Henry, first of all, congratulations. And what was your reaction when you were told that you were one of Becker's rising stars?
Yeah, thank you for having me, Eric. It was an honor. I think as a healthcare leader, Becker's is something that everybody reads, and it's just something that everybody respects. So to be named the rising star at Becker's and just to have a lot of the work that we're doing at Bassett recognized for not just Deanna and myself, but our whole team, it was really an honor. Really happy with our work that we're doing over here at Bassett.
Yeah, and let's specifically talk about your work, Henry. You're Chief Advanced Practice Officer and Associate Chief Clinical Officer, one of Bassett's highest clinical roles. What does all that mean, Henry?
I'm clinically trained as a physician assistant. I have experience in inpatient, critical care, and a lot of family medicine. In my leadership roles as Chief Advanced Practice Officer, I oversee all of our advanced practice clinicians, our APCs here at Bassett. That includes our physician assistants, our nurse practitioners, certified nurse midwives, and our CRNAs. And then in the Associate Chief Clinical Officer role, I'm one of 3 clinical leaders overseeing our medical group. And in that role, I oversee our departments of surgery, anesthesia, orthopedics, women's health, and the lab, and really help drive a lot of our outcomes when it comes to financial performance, quality measures, patient experience. All of those, fall into that role for those departments. It's a really great role for someone like me who's data-driven and really looking to move the needle in all those areas.
Yeah, and Henry, obviously, and we see it every single day at Bassett Healthcare, that patient safety, you guys go above and beyond. That is 100% the first priority. But talk about kind of the balancing act, because there are finances too. There are budgets. There are things you have to keep an eye on. So just talk about that line between making sure you guys have the best financial practices, but also the best care, what you guys do.
I think it's probably the most important thing that everyone in healthcare is focused on right now is really that balance. This is an unprecedented time in healthcare with COVID. We're having higher labor costs than we've ever had before. We're having lower reimbursement on our state and federal payers. At Bassett, the patient always comes first, and you're right, that quality has to be your first focus, the quality, the patient safety. But all the other things do matter, and I think that's a lot of what our executive leadership team has been focused on is how do we maintain the quality, maintain the service that we're known for, but also shine a spotlight, for our clinical leaders on the financials, right? The financials of medicine, the business of medicine, that is really important and probably more important now than it's ever been. We're doing a good job. In the news, there's a lot about other organizations that are struggling financially. And while we have our struggles, it's nowhere near the magnitude that a lot of these other organizations are facing. So we've still been able to keep that spotlight, really bright on the patient and keep them in the forefront of all the care we provide.
Henry, you're credited as being instrumental in Bassett's rapid telemedicine advancements during the pandemic. Talk about Bassett in particular, and what advancements did you guys make during the pandemic time?
It's a great question. So luckily, Bassett, being on a relatively smaller healthcare network, we have 6 ERs, 5 hospitals, a pretty robust primary care network as well. But we're able to be agile. And I think when COVID hit, everybody in healthcare had to be able to pivot pretty quickly to virtual ways to take care of patients. So I oversaw a lot of our telemedicine efforts along with my team, and we were able to pivot. I think to a lot of our leadership's credit, we were able to get everyone converted over to telemedicine. Our IT department worked nonstop to make that happen and get a lot of the technology rolled out within our electronic health record so that we were able to pivot probably within a week of our COVID outbreak here in upstate New York to be able to go right into video visits for patients. And it's something that's still around. I think anybody who's within our network is probably very comfortable doing telemedicine visits at this point because it is something that we pivoted to, largely during the pandemic, but has really been something that we've built up as something that's integrated within our electronic health record. All of our patients have access to test their equipment at home through the patient portal and connect easily through that. We've expanded it. I think that's the nice part is we started with just regular video visits, and now we have on-demand options for video visits. We have e-visits, which are patients are able to do, right from their couch if they're having issues. So a lot of movement in that. We also expanded our inpatient access for telemedicine, being a rural healthcare network. It is hard to recruit some of these specialists that you need for on-call services within a hospital. And really, sometimes we don't have the volume to justify hiring multiple of them. So we have telemedicine consult services for things like stroke and neurology, even pulmonology, inpatient consults, dermatology, all these things that are lower volume, but you really need to have someone available to evaluate a patient that comes in with that complaint. So those have been extremely successful as well, and we're really proud of the work that we've done building that program here for our community.
I would assume telemedicine is a real advantage in this area, seeing that it's so widespread and it's just such a large area that you guys cover.
There are so many benefits to virtual health and telemedicine, and the majority of them are for the patient. And I think that's the best part of it. It's good operationally for Bassett because we are able to cover a larger area, but it really is better for patients who don't have to travel, who might get access to a specialist, via telemedicine that they might not be able to access in a rural healthcare network normally. So it really is good for patients. And I'm glad you brought up our size. We do cover 9 counties. It's about 5,600 square miles, which is roughly the same size as the state of Connecticut here in upstate New York. So it is hard to offer, high-level specialized services to that whole catchment area. And telemedicine has allowed us to set up specialty clinics throughout our region. We have localized hubs where we really provide high-level telemedicine care, whether it's through partnerships with Columbia or the University of Rochester. We're able to offer these subspecialty services that we probably wouldn't be able to offer to these communities without telemedicine.
You sound very humble, but you have to be very good at your job at what you do to be recognized as one of the rising stars. Saying that, though, to get on this list, there has to be like that key ingredient that makes this all come together. And I would assume one of the facets of that is the great team that you work with here at Bassett Healthcare.
Definitely. Our team is phenomenal here at Bassett, from the top all the way down to everyone who works, taking care of patients in the hospital, in clinics, checking people in. Everybody is willing to do the right thing, and I think that's what matters. You have to want to take care of patients, and everybody that we have at Bassett is really unified in our mission to really improve the health and well-being of this community. And, that's what keeps us coming back, right? I mean, we face a lot of barriers in healthcare and with COVID, and, our team that has kind of come out the other side of that pandemic is really stronger for it. And yeah, just honored and humbled with the recognition, but it really is a team effort from everybody here at Bassett. For Deanna and myself, it's just been a wonderful experience working here.
Deanna spoke very highly of you, Henry. Now it's your turn. Why do you think Deanna made this list of rising stars? What makes her so successful?
Yeah, I mean, Deanna's fantastic. Deanna is well-rounded in everything you want a leader to be good at. And I think that's kind of the future of healthcare leadership is you have to be good at analytics. You have to be good at having a vision and seeing it through with execution. And you have to be able to develop the people around you and make sure that your team is performing at a high level. And I think Deanna brings all of those things to Bassett. She has just excelled since she's been here for the last 5 years with just increasing responsibility in every role she's taken on. And you always think it's going to be too much for her, and it never is. So she has just been one of our stars at Bassett for a long time, and it's great to see her get this recognition.
Henry, it was great talking to you. Thank you so much. And once again, congratulations.
Thank you, Eric. Yeah, it's been great.
That once again was Henry Knoop, Chief Advanced Practice Officer and Associate Chief Clinical Officer for Bassett Healthcare. Before that, we talked to Deanna Charles, Senior Vice President, Chief Ambulatory and Transformation Officer at Bassett Healthcare Network. Both Deanna and Henry announced as rising stars in healthcare by Becker's Hospital Review.